Team, I want to emphasize the importance of maintaining strict hygiene practices to prevent the spread of infections. This includes proper hand washing, wearing appropriate personal protective equipment, and cleaning and disinfecting surfaces.
I understand, Dr. Mihira. We should always wash our hands before and after patient contact.
Exactly. Hand washing is the most effective way to prevent the spread of germs. Use soap and water and scrub your hands for at least 20 seconds.
What about using hand sanitizer?
Hand sanitizer can be used as an alternative to hand washing, but it's important to use it correctly. Apply a sufficient amount of sanitizer and rub your hands together until they are dry.
Should we wear gloves for every patient interaction?
Gloves should be worn when there is a risk of exposure to bodily fluids. However, it's important to remember that gloves are not a substitute for hand washing.
Dr. Mihira, how often should we clean and disinfect surfaces?
We should clean and disinfect surfaces regularly, especially after patient contact. Use appropriate cleaning agents and follow the manufacturer's instructions.
MIHIRA, experiencing ankle swelling can certainly be uncomfortable, and I want to offer some gentle advice on how you can take care of yourself. This kind of swelling is often a sign that fluid is pooling in your lower legs, which is something we can usually ease with a few simple adjustments to your daily routine. The most important thing you can do is elevate your legs whenever you're sitting. Propping your feet up higher than your heart, perhaps with some pillows, for about 30 minutes a few times a day, can help gravity move that fluid away from your ankles. It's also really helpful to avoid staying in one position for too long, whether that's standing or sitting. Try to take short walks every hour or so. When you're sitting, gentle movements like pointing your toes up and down or drawing circles with your ankles, what we call gentle ankle exercises, can promote better circulation. Paying attention to your diet can help too. Reducing your salt intake might lessen the body's tendency to retain fluid. Finally, MIHIRA, please remember that if you're taking any prescribed medication, it is absolutely essential not to stop it without first speaking to the doctor who prescribed it. Your overall health plan is important, and only a medical professional can safely adjust your treatment. Before we finish, do you have any concerns or questions?